Today you will study histology of endocrine gland. First come to pituitary gland, which is a pea-sized gland lies within the sella turcica of the sphenoid bone. This is the histological slide of pituitary gland. Half of this is highly stained, whereas the another half is less stained. This is due to the acidophil and the basophilic secretory granule lies within the anterior pituitary. So highly stained, it takes stain. But posterior pituitary, it contains neuroglia as well as the unmyelinated nerve fiber, around 1 million. So it will not take a stain. Pituicytes, this is the neuroglia, lies within the posterior pituitary, and in between these two there is a cleft, that is hypophyseal cleft, and pars intermedia, which is the part of the anterior pituitary, lie just by the side of hypophyseal cleft. This is another slide, histological slide. Again, this is anterior pituitary, evidenced by the presence of acidophil and basophil. Acidophil take red stain, whereas the basophil take blue stain. These are the secretory granules, and here is the unmyelinated nerve fiber which do not take a stain. Posterior pituitary, and in between this is hypophyseal cleft, and after that comes intermediate pituitary, which is the part of anterior pituitary. Here also pituitary gland, histological slide. There is only anterior pituitary. This is again both anterior, and this one is posterior pituitary. In the middle this is hypophyseal cleft, and after that comes pars intermedia. Here is the pars intermedia, and this is posterior pituitary. Again, this is hypophyseal cleft. This is hypophyseal cleft. This is anterior pituitary having secretory granules, and then here is the pars intermedia, and then comes posterior pituitary. Where it lies? Now come to the Viva question. Where it lies? It lies within the sella turcica, present in the sphenoid bone. What are the parts of pituitary? Anteriorly, there is anterior pituitary shown in the pink color, which again divided into three parts. That is the pars. Here you can memorize very well. Anterior pituitary DIT, that is pars distalis. This one, the distal most, pars distalis. Pars intermedia, this one is the pars intermedia. Here lies pars intermedia. This one is the pars intermedia, and then pars tuberalis. Along the infundibulum, this is pars tuberalis in pink color. So DIT, that is descent. Look at this guy. In front he is descent, but actually he is mean guy. So mean guy behind. So part of the anterior pituitary, as it is anterior, so it is descent. So distalis, intermedia, and tuberalis. Where is the posterior pituitary? That is behind. It's a mean guy. So MIN, median eminence. This is the swollen part in the middle. This is median eminence in blue color. Then infundibulum. This is stalk-like structure, infundibulum. And then pars nervosa, MIN. This is pars nervosa. So mean. In front descent and mean guy behind. Now from which germ layer pituitary gland is developed? It is developed from the ectoderm. Posterior pituitary from the neural ectoderm, shown in the yellow color, whereas in the red color, this is anterior pituitary developed from the oral ectoderm, from the rathke's pouch. At the third week of intrauterine life, it starts making a pouch, the ectoderm of stomodium, that is the primitive oral cavity. It outpouches superiorly from a rathke's pouch. Where is this is neural ectoderm, which outpouches below. Okay, and both of these unite at 10th week of intrauterine life, forms pituitary. This is anterior pituitary, here lies, and then after some time it segregates with this origin site, and remnant of this rathke's pouch is remain as hypophyseal cleft. So here it is formed. Anterior pituitary developed from oral ectoderm, whereas the posterior pituitary developed from neural ectoderm. Why anterior pituitary is more stained than the posterior pituitary? Because anterior pituitary contains secretory granules. This secretory granules, 50% it is chromophobe cell, that it do not take a stain, and 50% it take a stain, that is the chromophil cell. Chromophil cell again divided into eosinophilic or acidophilic and basophilic. Eosinophilic cells are 70%, whereas the basophilic cells only 30%. Acidophilic cell, somatotrophs and lactotrophs. Somatotrophs secretes growth hormone, whereas the lactotrophs secrete prolactin. Whereas the basophilic granules are corticotrophs, thyrotrophs and gonadotrophs, which comes in 20%, 5% and 5% respectively, and secrete corticotropin, responsible for the cortisol production, and then thyrotrophs for thyroid stimulating hormone, and gonadotrophs, that is responsible for the follicle stimulating hormone and luteinizing hormone. And by this mnemonic we can memorize very easily. Salan gatak, this what we are saying here. This is mirchi ka salan. Wow, it's so tasty. मन तो करता है गटक जाऊं. It's so yummy. So salan, that is SALAN. So main SLL. So somatotrophs and lactotrophs. It is mirchi yukt. This mirchi ka salan. So mirchi, that signifies acidophilic or eosinophilic. Where is the gatak jaun? Man to karta hai gatak jaun. Want to eat. So gatak is basophilic. That is gonadotrophs, thyrotrophs and corticotrophs. Now, so it explains what is the ratio of acidophilic and the basophilic. Acidophilic, here we have seen acidophilic cells, that is 70%, and where is the basophilic cell? Only 30%. Another Viva question is, what is the nature of secretion from the anterior pituitary and the posterior pituitary? Anterior pituitary secretion is under the effect of releasing hormone and the inhibiting hormone. Whereas the posterior pituitary, it has got herring body, which is the swollen terminal button of these nerves coming out from the hypothalamus. As this is developed from the neural ectoderm, so एक ही किचन से खाना बन के आता है. ये तो खुद का ही बच्चा है. ये ब्रेन के पार्ट हाइपोथैलेमस से ही ये डिसेंड हुआ है. इनफंडिबुलर प्रोसेस फिर बाद में बन के, दैट इनफंडिबुलर प्रोसेस it further develop into the posterior pituitary. So food is coming from the same kitchen. It has got preformed hormone enclosed within the herring body, whereas secretion of anterior pituitary is under the effect of inhibiting hormone and the releasing hormone. What is herring body? It is nothing but the swollen terminal button of the hypothalamohypophyseal tract, okay, which starts from hypothalamus and ends at hypophysis, that is pituitary. Why posterior pituitary is less stained? Due to the presence of unmyelinated nerve fiber, there is 1 million unmyelinated nerve fiber which do not take a stent. What is pituicytes? It is neuroglial cell interspersed in between the unmyelinated nerve fiber. What is hypothalamo-hypophyseal portal system? Which regulate the secretion of the anterior pituitary. This is superior hypophyseal artery. It forms primary plexus at the region of MIT, that is the median and eminence, and pars tuberalis and infundibulum. Okay, and this is connected to the secondary plexus present in the pars distalis via hypophyseal portal vein. And now the secretion is going into the blood via the anterior hypophyseal vein. This is hypothalamo-hypophyseal portal system which is present in anterior pituitary. And what is hypothalamo-hypophyseal tract? Present in the posterior pituitary. The signals for the secretion as well as the product is also, as it contains the preformed hormone present in the herring body coming from the supraoptic and the paraventricular nucleus of the hypothalamus. So, hypothalamo-hypophyseal portal, hypothalamo-hypophyseal tract present in the posterior pituitary, whereas the hypothalamo-hypophyseal portal system present in the anterior pituitary. Which hormone is secreted by anterior pituitary? Anterior pituitary, here it is written. We already that anterior pituitary has got acidophil cell and the basophil cell, secretory granules. Acidophilic cells are the somatotrophs and the lactotrophs. Somatotrophs produce growth hormone, lactotrophs produce prolactin, and the basophilic granules are the guttuck, that is gonadotrophs which secrete FSH, LH, it is written, and then T for thyrotrophs which TSH, which is governed by the TSH, and thyrotrophs, and then C for corticotrophs, which is ACTH, adrenocorticothyroid stimulating hormone. Okay, and posterior pituitary secretes oxytocin and the vasopressin. Now, which hormone is secreted by the posterior pituitary? It is oxytocin and the vasopressin. Vasopressin, another name is antidiuretic hormone. Now, what is rathke's pouch? It is nothing but the outpouching of a stomodium entitled to make anterior pituitary. Stomodium is what? Is the primitive oral cavity. What is pars intermedia and what it secretes? Pars intermedia, here we have seen, this is pars intermedia, this is anterior pituitary and this is posterior pituitary. In between these two there is hypophyseal cleft, and after this hypophyseal cleft in green color, this is pars intermedia, which is also the part of anterior pituitary. And hypophyseal cleft, what is hypophyseal cleft? It is the remnant of the rathke's pouch. Okay, and pars intermedia secretes melanocyte stimulating hormone. Now come to histology of thyroid gland. Thyroid gland, we all know, it is a butterfly shaped gland, lies in front of the trachea in the lower neck. It is the only endocrine gland which we can palpate very easily, and it depends upon the external world for its raw material, that is iodine. Here this is the histological slide of thyroid gland, which is full of thyroglobulin, which is present in the central lumen, which is a colloidal, which has got colloidal nature. On the slide, here also it is filled up with the thyroglobulin. This is one follicle. This is one follicle which is formed by union of many follicular cells. all around where my cursor is going, many follicular cell in the just ball like fashion. Ball is what? From with which we play ball, bat ball. So ball, just like ball, it is spherical. All around there is follicular cell, and many follicular cell unite to form one ball, that is follicle, and having a central lumen which is full of thyroglobulin. So this is in pink color, this is thyroglobulin, and this is follicle, one follicle which is made up of many follicular cell. This again is give pebble stone like appearance. This histological slide gives pebble stone like appearance, just like on the sea coast. Now what is the difference between the resting and the active follicle? Resting follicle, this is resting follicle and this is active follicle. Resting follicle, it is big in size and this is a small. Resting follicle, all are sleeping, taking rest, so flattened or lying on the basement membranes and flat. So it is simple squamous type of epithelium. And this is active follicle. Many events are going on within these cells, these follicular cell, which unite to form one follicle. So this is simple cuboidal in nature, where this one is resting, flattened, taking rest. So, and this is big in size. Why? Because there is a large lumen full of reservoir, that is thyroglobulin, which is not used up by these resting cells. But here we can see this thyroglobulin is used up by the follicular cell. T3, T4 is formed within this follicular cell with the help of thyroglobulin reservoir stored within the central lumen, so that all cell can take this raw material from inside and can be used. And look, this has got a scalloped border, just like when we scoop ice cream, it shows a scalloped border present in the active follicle, which is evidence that reservoir is used up by the follicular cell. So follicle are large, follicle are small. It is lined by the simple squamous epithelium with few microvilli. Microvilli is meant for taking this stored up material, because there is no event is going on, all are sleeping. The cells are sleeping. So only few microvilli. We can compare microvilli with the hand, which is taking the raw material from the storeroom. The central lumen is compared with the storeroom. And nucleus of epithelial cell is dark. But because all are sleeping, their makeup is maintained. Whereas in this case, all events are going on within these cells. So they are tired up. Their face is pale. So it has got, the nucleus is pale. Okay. And as these ladies are sleeping, they are not taking part to form any dishes within this kitchen. So their beauties are maintained. So nucleus is dark, and here many dishes are forming within this follicular cell. So nucleus of epithelial cell is pale, which can be compared with the face of ladies. Large amount of acidophilic colloid in the lumen, because no one is taking this stored material like suji, maida to make any dishes. This is stored material, thyroglobulin. And here many dishes are are being prepared within this kitchen. and which size depends upon the amount of ladies within this kitchen. So little amount of colloid with scallop border because they are used up. Now size of each follicular cell is proportional. Here we have written size of each follicular cell is proportional to the number of ladies working in the kitchen. Central lumen is a storeroom full with the raw material with suji maida. Microvilli are hands of lady approaching raw material. Nucleus symbolizes face of lady. Okay. And these are the hands which can be compared with the microvilli, which is more in case of active follicle because they are taking the raw material. And look at this tied up lady. Her face is pale just like nucleus of active follicle. Now tell me the type of epithelium in resting and active follicle. In resting phase, it is the ladies are flattened. They are taking rest. So simple squamous. And this active follicle simple cuboidal, or you can say the cuboidal to columnar. What is stored in the lumen of follicle? It is thyroglobulin. Which follicle has got a scalloped border? Active follicle. Where T3 and T4 hormone are formed? Within the follicular cell. These are follicular cells. Within these T3, T4 are formed. Whether T3 or T4, which will be in more quantity and more potent? 4 is higher number than 3. So T4 will be more in quantity. But T3 is more potent. Just like chawal dal. In our dish, chawal dal is more in quantity. But sweet dish, even though it is less in quantity, but more potent. That ये दिमाग की बत्ती खोल देता है, दिमाग काम करने लगता है अच्छे से, even though it is less in quantity. So T3, T4, T4, 4 is more than the 3, so 4 will be more in quantity, T4. But as far as the potency is concerned, T3 will be more potent, even though it is present in less quantity, just like sweet dish. Now, what is parafollicular cell or C cell and what is secretes? In between these follicular cell, these are the follicular cell forming follicle. This is one follicle, here is one follicle made up of many follicular cell, and in between these follicle there lies parafollicular cell. Here it is written here parafollicular cell, okay, or C cell which secrete calcitonin. Why during thyroidectomy true capsule is also resected out? This what we are seeing is here lies thyroid gland and it is enveloped by first true capsule, which is the condensation of peripheral stroma, and this is false capsule externally, which is nothing but the derivative derived from the pretracheal fossa, okay, and beneath the true capsule is this green one, the light green, this one. Within this in blue color, these are the venous plexus. So when we resect out thyroid gland, we take it out. The line of resection lies in between the true capsule and the false capsule, so that this venous plexus should not be tampered and it will not lead to any fatal hemorrhage. So line of resection is like this, where my cursor is going in between these two capsules. So here the mnemonic comes, T will go with T. That if we do thyroidectomy, we also resect out true capsule. Just opposite to prostatectomy, that removing of prostate gland. Now coming to histology of adrenal or suprarenal gland, which lies suprarenal, that A verb kidney. It is of paired structure. This is right suprarenal, which is triangular in shape, and this is left suprarenal, which is semilunar. This is the histological slide of adrenal gland. Here the lining is GFR, not glomerular filtration rate. It is zona glomerulosa. Then comes zona fasciculata, and then zona reticularis. And externally there is capsule. And at the center there is medulla. And these are the cortical part. First capsule, then come adrenal cortex, and then adrenal medulla. Adrenal cortex again divided into GFR, that is zona glomerulosa, zona fasciculata, and zona reticularis. On the slide, this one is also of adrenal gland. Also, come to Viva Question. Tell me the layers of adrenal cortex. Here it is written: zona glomerulosa, zona fasciculata, and zona reticularis. Glomerulosa produce mineralocorticoids like aldosterone, fasciculata secrete glucocorticoids like cortisol, reticularis produce androgen or sex hormone. Here up to here in green color, here it is written zona glomerulosa. Then comes zona fasciculata up to here, and this is, so this is 1/5, this is 3/5, and this is 1/5, and then come medulla, which is evidenced by the last side vein. This glomerulosa presents glomerulus, inverted U-shaped arrangement of cell, inverted U-shape. And then zona fasciculata, there are vertical ridges, rod-like ridges. And zona reticularis, net-like pattern. Here we can see this zona glomerulosa, inverted U-shaped. This is columnar to polygonal cells, and this is sinusoids in between. This is sinusoids, and there are few fat droplets within this. And then after that comes this 2 to 3 cell layer thick rod-like, vertical rod-like zona fasciculata, and it contains many fat droplets. So each cell also known as a spongocyte, and this is also polyhedral cell. And in between this structure, this longitudinally placed sinusoids. Okay, and then comes zona reticularis, reticular pattern, branching and anastomosing type, and then medulla. How adrenal cortex and medulla is developmentally different. This is adrenal cortex in blue color, and here is adrenal medulla. Adrenal cortex is developed from the coelomic epithelium, which is mesodermal in origin, whereas the medulla is derived from the neural crest cell, which is ectodermal in origin. Here it is written, a large outer part, that is cortex, mesodermal in origin, developed from coelomic epithelium. A small inner part, medulla, developed from neural crest cell, which is ectodermal in origin. Always asked in the exam. What is the blood supply of adrenal gland? This in blue color, these are the adrenal gland, and it is supplied by, this is superior suprarenal, this is middle suprarenal, and this is inferior suprarenal artery. Okay, this is superior suprarenal, middle suprarenal, and inferior suprarenal. Superior suprarenal is the branch of inferior phrenic artery. This is inferior phrenic artery. And middle suprarenal is the direct branch of aorta. Here, this is one, and this is also middle suprarenal, direct branch from the aorta. And inferior suprarenal is the branch of renal artery. This one and this one. Whereas in case of vein, they are not in three pair. They have only right suprarenal vein and left suprarenal vein. Right suprarenal vein directly drain, here this blue one, short blue one, drain into the inferior vena cava directly. Where is the left one? Drain into the renal vein. This is a twist in the story, that right side suprarenal vein, suprarenal gland drain into inferior vena cava, whereas in the left side it will drain into the left renal vein. Now tell me about the venous drainage. It's over. That where cells are arranged in inverted U-shaped pattern in GFR glomerulosa, zona glomerulosa. Here inverted U-shaped pattern. After that, which hormone is secreted by the adrenal gland? It is by the glomerulosa. We have already read that zona glomerulosa secrete mineralocorticoids, then F zona fasciculata secretes glucocorticoids, and zona reticularis secretes sex hormone. What is pheochromocytes or chromaffin cell? Actually, chromaffin cell is nothing but the postganglionic sympathetic neuron. What we are seeing here, this is preganglionic sympathetic neuron, this is postganglionic. Okay. But in case of adrenal medulla, as it is nothing, adrenal medulla is nothing but the departed sympathetic ganglia. So here this is the body of postganglionic neuron. This is preganglionic and this is postganglionic. So here this is postganglionic, which is known as chromaffin cell, who has lost their axons and dendrons. Okay, this has lost only this much. The body or soma is retained for lifelong, which is known as chromaffin cell. So chromaffin cell is supposed to be what? Is the soma or the So chromaffin cell is supposed to be what? Chromaffin cell is supposed to be the soma of the postganglionic neuron, which has got lost axons and dendrons. What is ganglion cell in the adrenal medulla? In the adrenal medulla, there is not only chromaffin cell, there is also this one is the chromaffin cell, okay, of pheochromocytes. But here also there is ganglion cell, which is parasympathetic neurons. Every viscera is supplied by autonomic nerve, that is sympathetic nerve and the parasympathetic nerve. This chromaffin cells is the sympathetic, postganglionic sympathetic nerve, whereas the ganglion cell is the parasympathetic nerve. Which one is essential for our life? Adrenal cortex or medulla? Adrenal cortex. Adrenal cortex is essential for our life and often asked in the exam. If it is not there, we have to take its replacement, the mineralocorticoids, glucocorticoids and the sex hormone from outside. We can't live without it, but we can live without medulla. Now, what is the difference between the adrenal cortex and medulla regarding its mode of secretion? In the adrenal cortex, here we can see this is about the mode of secretion of adrenal cortex and this is of adrenal medulla. In the adrenal cortex, there is, it's just like our kitchen. Whenever needed, the product is formed, that is the mineralocorticoid, glucocorticoids and the sex hormone. But adrenal medulla is just like the hotel. It has got preformed hormone and when needed, this preformed hormone released, just like the packaging system of hotel. That's why it is not essential, but in our home kitchen is essential. So adrenal cortex is essential, but adrenal medulla is not essential. What is the difference between left and right suprarenal gland? This is the right, which is triangular, whereas the left is semilunar. And regarding its venous drainage, they are different. That the right adrenal gland it directly drain into the inferior vena cava, whereas the left one drain into the left renal vein. Thank you.